We're incredibly excited to be opening our clinic on McDowell Street. I think it's challenging during this time. Obviously, we're all confronted with social isolation, with the coronavirus, and really opening our doors in a virtual fashion is exactly what the community needs right now.
When you walk in Eleanor Health doors, whether that's physically or whether you virtually walk in, you will immediately feel that we appreciate your inherent value as a human being.
We're first to market when it comes to a unique payment model and care delivery model around substance use disorder and addiction. Our evidence-based care model includes medication, which is shown to reduce relapse and support people's journey through recovery. Next, we provide patients with therapy, individual, group, and telehealth delivered therapy. And then we get to those whole person components, which are delivered by our community recovery partners, which are peers, those with a lived recovery experience. And those folks really are the glue to our model.
It is our intention to join the community, work on stigma reduction, work on education, figure out what continuum of treatment exists in that community, and help to fill in the gaps.
Eleanor brings together the team needed to care for folks who struggle with complex substance use disorders and complex medical problems. We take a whole person approach and use a harm reduction mindset to try and overcome the barriers to recovery.
And so every person gets a comprehensive assessment that includes a medical assessment, a nursing assessment, a psychiatric screening for anyone who screens positive, psychiatric evaluation and medication management as needed, as well as an evaluation of the social drivers of health, stress, support system, meaningful connectedness. And we really use that information to develop an individually crafted treatment plan.
Eleanor intends to develop close partnerships with primary care providers. We want to help you by using our skills to treat the substance use disorder.
Hello, my name is Neil Guffey. I'm one of the physicians that does MAT for Eleanor Health and find it to be quite different than other MAT programs I've interacted with in the past. The difference with Eleanor Health is the extra steps it takes to make sure that the community members really have what they need and feel supportive.
The Eleanor Health model is integrated. Asheville understands the purpose of integrated care and why it doesn't make sense to just treat one part of the body as if the brain is separated from everything else. We're different from other addiction treatment providers in that we will never fire you for your addiction.
How fortunate we are to have Eleanor Health in North Carolina. The foresight of the founders and leaders, Corbin Petro and Nzinga Harrison, is unparalleled. They set out to build a truly differentiated model of care for substance use disorders. People are truly seen, and their strengths are drawn out and built up to drive that path to recovery. I am humbled every day by the work of Eleanor Health, and I'm excited that this team is ready to serve in Asheville.
When you join our community, as a population, our community members' lives are getting better and their health is getting better.
So we deliver the best in evidence-based treatment in our care sites, and then we extend the footprint of those clinics through technology. 100% of our care model can be delivered virtually.
Many practices take an approach of complete abstinence. At Eleanor Health, we know that people wrestle with polysubstance abuse. And our goal, first and foremost, is harm reduction. We want to prevent people who seek care with us from dying.
Recovery capital changes over people's lives. During COVID-19, a lot of people have lost a lot of recovery capital. And if your recovery is worse, give us a call. We can help you think about other ways to increase your recovery capital to help give you an edge to get back to sobriety.
I love this phrase that we use, hashtag recovery for life. Your life can be amazing.